So my name is Javeria Qureshi. I'm a general trauma surgeon from outside of Chicago, Illinois. I'm extremely honored that I got to serve with PAMA's team to Gaza this past month. It was enlightening. I had wanted to come for many months. I got to work with many Gazawi surgeons and participated in their residency program, and I feel very privileged to have done that. I think the health system in Gaza has been traumatized. It is not what it used to be. Taking into account the limitations right now of supplies and personnel and infrastructure, I think the health system is overwhelmed with the injuries it is seeing. I worked at a hospital in Gaza City where we saw a lot of trauma, repeated mass casualties every day, repeated children, women, men with shrapnel injuries, gunshot wounds, blast injuries. Probably the hardest injuries are complex abdominal injuries in children, which will require maybe multiple operations. And in a setting where the healthcare workforce is stressed, they're going to have a very hard time having the follow-up for the care they need. I'm very honored to have served here. I want to come back here. I feel like I've built relationships here. I plan to stay in touch with surgeons here. I was very impressed by the level of knowledge of surgeons here, and they recognized that they were dealing with limited resources and having to manage cases in a different way, but they actually knew what the standard of care was. I wish for the Gazawi people in Gaza to have peace, to not have bombs falling on them, to have an opportunity to heal. I think not only the patients, because even the healthcare workers are patients in a way. They face the psychological stress of working in a war zone. And ideally for them, I would want peace where they can actually heal, because there's no opportunity to heal in the current situation. And I would definitely come back. You know, I think each person has to assess their own tolerance of stress, their risk tolerance. I would say yes, but recognize that it is a war zone. And if you are somebody who, in that environment, that stress would make you panic and make it very difficult for you to function, then it may not be the right situation for you. However, if you are somebody who is used to stressful situations, and you have a skill set where you feel like you could support the healthcare workforce, I really encourage you to come. It's really a privilege to work with the healthcare workforce here, and they've been facing a tremendous amount of stress for the last 23 months, almost 24 months. And the presence of providers, doctors, and other medical providers from outside of Gaza gives them a sense of support, even though the system is different for me and I don't speak Arabic fluently. I have to adjust and learn also from them how they're adjusting to the limitations they have. But if one is used to those environments or has experience in those environments, I would highly encourage you to come to Gaza. I think the hardest, people can see pictures of the level of destruction, but what one doesn't recognize is people had normal lives, and people are still trying, people as in Gazawi are still trying to continue to have normal lives. There are students who are trying to continue their education. There are residents in surgical training who are trying to keep their skill set. And what was just heartbreaking to see is how hard basic things in life are. The ability to charge your phone, the ability to obtain clean water, having a safe place to stay, knowing that if I'm at work, is my family safe? That's a stressor that most people are facing. And at the same time, trying to continue normal lives. I think PAMA has done a great job. They have a very good system in place. They really support the healthcare workers who come here. And I think it's really an honor to be in Gaza. It is a difficult process, but it's an honor to be here. And I think for anybody who even thinks they want to come, try. You should come. You should come. Whether the war is continuing or whether it's after the war, I think Gaza will need us to support.